All right, hi Dolores. So I just finished getting all of your assessments done, and there are a couple of things that I noticed. But before that I get into it, I just want to make sure it's all right with you if I talk about and explain some of the things that I saw. Maybe ask you a couple questions about your home care and stuff like that. Alrighty. So, a couple of things that I saw today. The first, I found some calculus. I found it in between your teeth, below your gum tissue. And then secondly, I noticed when I was flossing you, your gums were red and swollen, which is a major sign of gingivitis. So I'll break down each of those things for you today, and then you can ask me any questions that you have, and we'll go from there. Does that sound good? Okay, great. All right, so first I'll talk about this calculus stuff that I found. Have you heard that word before? Do you know what it may mean? Nice, yeah, essentially that's what it is. So basically, calculus is mineralized biofilm, and biofilm is basically buildup of bacteria, like you just said. So, we have bacteria in our mouths all the time, and actually our mouths are they naturally self-cleanse by means of chewing and, even just having saliva in your mouth. But some of those bacteria are a little bit smarter than the rest, and they know the hot spots where to hide out. And those hot spots are going to be right in between your teeth, and usually they're areas that your toothbrush can't get to. So I actually have a little solution here that can show you where you have most of that bacteria buildup. Is that okay if I show you? Okay, awesome. This is when I would disclose her and rub that disclosing solution all over, give her the mirror, and show her where all the dark pink spots are. Okay. This is me giving Dolores the mirror. All right, Dolores. So do you see the places in your mouth where it's really dark pink? That's where the heaviest amount of biofilm is. So you can see it right in your mouth, right where it's built up, right in between those teeth. And actually, I calculated over here a plaque score at about 55%. And ideally, we want that number to be lower than 10%. But don't worry, there's good news. Biofilm is easily removable, and we can reverse this with just brushing and flossing. That's a great question, Dolores. So, calculus and cavities, they're not the same thing, but they do have one thing in common. The main culprit of both of them is going to be biofilm. So, biofilm is always the issue here. So essentially, calculus, like we just talked about, is going to be that mineralization, that hardened biofilm, that got mineralized by your saliva and all these organic components and, all this stuff, and it hardens, creates a little crystal that's on our tooth. And cavities is essentially the breakdown of our tooth and the decay of tooth, and we don't want either. But biofilm is going to initiate the cavity because there's an acid in biofilm that when that acid gets released, it starts that demineralization and that breakdown of the tooth. So we always want to be removing the biofilm. And the great thing about biofilm is that A, it's easily removable. B, once you remove it, it can't keep living. It has to restart all over. So, it starts out as this little bacteria and it grows and grows and grows. When you remove it, starts over at square one. You're always going to have a little bit of biofilm on your teeth. It exists everywhere, but removing it with brushing and flossing day and night is going to help so much. Yes, of course. It's a great thing to learn, and I will definitely be educating you on how to get the most effectiveness out of your brushing and flossing routine at home. All right, Dolores, so let's get into what I saw when I was flossing. So when I was flossing you, I saw some generalized red and inflamed gums, and basically that means that pretty much a lot of your teeth were red and swollen. It wasn't just in one area, it was around most of your teeth. And that is a big indication of gingivitis. Do you know what gingivitis is? Have you ever heard of it before? No problem, Dolores. Let me grab my visual really quickly. This will help me explain what gingivitis is, and the disease process a little bit more. All right. So this is going to be what a healthy mouth looks like. As you can see, the gum tissue is pink. There's no signs of swelling, any inflammation, anything like that. We have our tooth We have the bone right here, this cheese looking stuff. We have the gum tissue, that pink stuff right around there. And then we have these little ligaments in between the bone and the tooth that are going to hold the tooth in place and hold it onto that bone. So what happens is when someone stops brushing and flossing, that bacteria, that biofilm that we were talking about earlier, it starts to go to those hot zones like we were talking about earlier, right in between your teeth. It starts to build up in these pockets right here, right where that instrument is pointing to. And this is a spot that your toothbrush can't really reach, and that's where flossing is going to come in. So when you're not flossing, the bacteria, they hang out in those pockets and they multiply. And eventually, your body's going to realize what's going on, and it's going to start to send blood to that area to help fight off the bacteria. And that's how our bodies naturally fight off infections. They start sending blood, and then that's when you'll see this gingivitis here. This is an early stage of gingivitis. You can tell that the gum tissue up here is red and swollen because our body is sending blood to it. It's trying to fight off that bacteria that's in there. So we get swollen gums. They can bleed easy. They can hurt. And you can kind of see in this picture here, right in between the gum right there is looking red, kind of how yours were looking like. And you can also notice at this stage, we still have all that bone under there. We have no bone loss, and we still can maintain the integrity of that tooth. And I think I mentioned this earlier to you, Dolores, but gingivitis is reversible. So just with brushing and flossing, you can reverse this swelling and this irritation in just 2 weeks. It'll go right back to normal, and you'll be looking like this right over here, like this mouth. So let's just say we have this gingivitis, and let's just say that this infection gets worse. And it keeps growing, and it keeps getting worse, and it keeps going on. Eventually, we could be looking at a different disease called periodontitis. And this is the different stages of it right here in these pictures. So as you can see, the redness and the swelling gets bigger, more bacteria, more buildup, more infection. And then if you look over here, you can start to see that bone. We're starting to see some bone loss over here. And this is not what we want. This is what we're trying to prevent. We're not seeing this yet, thank God. But once you have bone loss, unfortunately, that's when it's not reversible anymore. We can't grow a bone once it's been lost. So that's why when we're in this stage, we really want to get you brushing and flossing because we don't want this to happen, right? And it's an easy thing to reverse. I mean, I'm sure that after today, after I show you a proper way of brushing and flossing, that you will be back to this normal, healthy mouth in no time. Okay, for Dolores, I selected the bass or base. I don't know how to pronounce it. I think base. Well, both. Okay. I selected the base technique for her, other than the Stillmans, because the Stillmans, like they're similar, but I have on my notes here, Stillmans, the major difference between it is in the Stillmans, you are not flexing the bristles into the gingival sulcus, which we want. So in the base method, you are flexing those bristles into the gingival sulcus, and Dolores has plaque buildup problems, so that's why I picked that method for her. The Charters method is good for orthodontics, and she doesn't have anything like that, and the Phones method is great for children, so that's why I'm taking the base method. And I'm going to show her how to floss, and maybe give her the option of an interdental brush too, because those can help. I'm going to recommend a soft bristle toothbrush. I'm going to recommend an electric toothbrush, but they're expensive, so that's why I'm going to show her this toothbrushing method. I'm going to recommend her a tongue scraper because she's complaining of stinky breath. Alright, Dolores, so before we get started, I just want to know what your home care routine looks like. Okay, nice. That sounds like a pretty dang good routine to me. Brushing every morning and night is fabulous. That's great. How long do you brush for approximately? A few minutes? Yeah, nice. So the suggested brushing time actually is 2 minutes. So it sounds like to me you kind of have an idea that you should be going in there a little bit longer than just like 10 seconds, kind of get in there, get your mouth all minty and then spit. So that's great to hear. All right, so let's get my Type It On out and then I'll show you how I want you to be brushing and flossing. All right, Dolores. So I'm going to show you first on the bottom half of your mouth, then I'll show you on the top. It's the same method for both, but I just want to really emphasize these angles that I'm about to show you so it, makes sense and we can put it all together. So what you're going to want to do is take your toothbrush and instead of just placing it on the tooth just straight on, I'm going to have you angle it up a little bit or down at a 45-degree angle into the gums. So if you can kind of sit like this, not straight on, but a little tilted up into that gum. And the reason why I want to have you at that angle is because when you have it tilted and you have those bristles into the gums, those bristles will really get under the gum line and in between your teeth more than they would if you just had it straight on. And since I was seeing most of the plaque buildup in between your teeth and under that gum line, this will really, really help you. So what we're going to want to do, get that angle, get it down into the gums, and then you're just going to gently wiggle it back and forth and flick up. And flicking up is going to help just get all that stuff off of there and get rid of it. You're not going to flick down, but you're going to flick up, kind of into your mouth and away from your lower half, so up towards the upper half. And I know I used to do this all the time. We just get in there, we just scrub mindlessly, and it's just like get every tooth, get everything sudsed up. But we really want to kind of focus on just almost doing like one section of teeth at a time. I'm kind of doing the back two, flick up, then I'm doing the next two, flick up, and then, you're doing like a section at a time. And take your time with this. It's not supposed to be 10 seconds and done. The average brushing time is about 2 minutes. And this will really make a difference, trust me. And then on the front teeth, it's the same. You're going to angle it down into that sulcus, wiggle it, and flick up. And I'll show you how to do the backs of your teeth, because this is when it gets a little bit interesting. I know when I saw this for the first time, it blew my mind a little bit. So what you're going to want to do is when you're trying to brush the backs of your teeth here, instead of, placing your brush behind it like this, because I'm not really hitting them, if you can tell. I'm kind of just hovering over them. We're going to want to get our brush vertical. And again, we're going to want to angle it into the sulcus. There we can see now. And you're just going to wiggle it and flick up, wiggle it, and flick up. And again, you're doing kind of one tooth at a time. And this, you're not going to have toothpaste spraying everywhere. Don't worry. I know when I first tried it, I was like, oh gosh, toothpaste is going to spray over my mirror. But it doesn't. Because if you're doing it gently, it won't. That's how you'll know if you're doing it gently. So that's how you do it down there. And then on the top, it's just the same thing, except for instead of angling it down, you're going to angle it up. But again, it's just into that gingival sulcus, into those gums. So you get in there, disrupt that biofilm, get that bacteria, say you're not welcome here, this is not your home, and then flick it out. Next section, again, flick it out. Again up here, flick it out. And then again on the bottom, brush vertical, wiggle it, and flick it. So this method will help you a lot. And I'm also going to show you how to properly floss. And then we will I'll put my PPE on and we'll get in your mouth and we'll do it for real, all right? All right, Dolores, now I'm going to show you how I want you to be flossing. And I know that a lot of people don't like flossing. I know that it can be a pain. I know that it can take a while. I know you can get your fingers messy, but this really will help you in your particular situation because that brushing method that I just showed you will also help a lot and improve the gingivitis, but there's always going to be those spots that your toothbrush can't reach, and flossing is going to help so much. So I will show you what I want you to be doing. All right, so show you here. Can you see that? Yeah, you can. All right. So you're going to grab a piece of floss about an arm's length. They're about, 12, about a foot long. And you're going to go ahead and you're going to wrap that floss around your middle finger. I'm struggling. There we go. Around that middle finger. Just enough so you can hold on to it. And then you're going to get the other side of your floss. And you're going to wrap the rest around the other finger like this. And wrap it until it's a little bit in the middle. And you're going to use your thumb and your index finger to control it. And that's going to do all the work for you. So what you're going to want to do is you're going to place that floss in between your teeth and just gently kind of saw it in between like that. And then what I'm going to have you do is cup the piece of floss around that tooth in a little C shape. So you're just cupping it, and we're going to just gently move it up and down. These teeth are a little slippery, but just gently move it up and down. And then we're going to cup the other side, and just gently move it up and down. And then to remove the floss, you're just going to saw it in between, gently remove it like that. We don't want, I remember when I first started flossing, I thought it was just you kind of went in and ding, 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 and just kind of, okay, I flossed. Yeah, great, cool. But really, we really want you to be hugging that tooth and moving it up and down, because that is going to get rid of that biofilm in between your teeth where that dark, dark pink is, and that's going to really get rid of it. These teeth are a little slippery. I apologize. That's going to really, really help. And same thing, on these teeth back here, you're just going to cup it around that little C shape and gently move it up and down. And then when you're removing the floss, just gently saw it and take it out. We don't want to flick it out, because that can fling gross stuff onto your mirror. And also you could damage that gum tissue. So again, place it, cup it, up and down, other side, up and down, and saw it out. All right? So when I would done my PPE, in my head, Dolores would just take the toothbrush and just begin scrubbing. And then I would really emphasize that you want to do small sections at a time. And then I would also really emphasize helping her get that angle and flicking it away. And then she would do it, and then she would get it, and I'd be like, oh my gosh, good job, that's so great. And then I'd, ask her to, show me how you would do it behind your teeth. Then she'd do it, and I'd, emphasize the 45-degree angle again, emphasize the importance that we want it into that gum, so to disrupt the biofilm. And then when she's flossing, I would help her, and she would get it right away, and she would tell me, oh, I just thought that you just went in and you got it, but I can see how, scraping on each side would really help. And I'd say, yeah, that is how I thought how it was too, but it makes a difference when you change it up. And she would maybe complain that it hurt a little bit, and maybe we saw a little bit of bleeding, but I would just say, hey, don't worry. I know it hurts, and I know it might be bleeding, but again, that 2 weeks, this can be reversible, so just keep doing this and take that little bit of extra time to really commit to your brushing and flossing, and you will be pain-free and no bleeding very soon. Okay, so after I did that whole thing with her, then in my head she would ask me, so is this going to help with my bad breath? And then I would say, yes, Dolores, that's a great question. I know that your chief complaint coming in here was having bad breath, and brushing and flossing is going to help that a lot. But what I'm also going to recommend to you, which I think you would really benefit from, is a tongue scraper. So this is what it looks like. It's basically this big metal looking VU thing. And what you're going to do is just stick out your tongue, and you're just going to want to gently just kind of scrape down your tongue. And essentially what this does is you have these little taste buds, little papillae all over your tongue, and they love to just cling on to stuff. And, food and bacteria and coffee, we all know coffee breath, not very cute. But what this does is it will scrape all of that off. And yes, brushing your tongue does help, but this is such a game changer. I got a pack of 4 for $9 on Amazon. I just searched tongue scrapers. And this will really help improve your breath, and it also will just improve the health of your oral cavity. You'll be able to taste better too. That's what I noticed after using this for a couple of weeks. It is a little intimidating at first, so I would start out slow. You don't have to shove it all the way in the back of your mouth. And just gently scrape, and you will actually see this white kind of buildup. It's a little bit gross, it's a little alarming, but it is really, really satisfying, and this is definitely, something like this is definitely going to help you with that bad breath problem. So definitely search on Amazon. I'm pretty sure they have ones at Target too. They might be a little bit harder to find, but this was just the number 1 recommended one on Amazon, and I like it. So definitely recommend one of these. All right, Dolores, well, that is about all I have for you today. I'm going to send you home with some goodies. I'd send her home with your classic toothbrush and toothpaste. All right, so we're going to work on those angles, those 45-degree angles, right? Getting those bristles into the gums. We're going to work on flossing, and combining those swollen red gums will be back to that healthy, nice pink color in no time. Get a tongue scraper. That will really help with the bad breath. They're cheap. Amazon is super easy. And then it looks like you haven't been to the dentist in about 5 years. And in your particular case, I really want to keep tabs on how you're doing and how your oral health is looking like. So I want you to schedule a 6-month appointment with me, okay? I know the dentist is not may not be your favorite place to go, but I really want to make sure that we're getting on top of this and that we are getting this taken care of because this is reversible and I really want you to have the healthiest mouth that you can have, okay? And keep coming back to me and I can give you more advice, recommend more things, and I can answer any more questions that you have. But let's get that appointment scheduled and I will walk you out, okay?